Welcome to the slide presentation of image quality of chest radiograph. Complete assessment of chest radiograph requires consideration of image quality. This involves observation of the rotation, inspiration, penetration, and inclusion. If the image is not of best quality but the clinical questions can still be answered, a chest radiograph need not be repeated. Firstly, check for rotation. Rotation for frontal projection should be minimal. It can be assessed by comparing the medial ends of the clavicles to the spinous process of the vertebral body at the same level. For example, the patient of this radiograph doesn't show any significant rotation. Secondly, check the adequacy of inspiration. Chest radiograph should be taken with the patient in full inspiration. The exception is when looking for a small pneumothorax, as this will show best on full expiration. A good inspiration on a PA chest radiograph shows at least 9 posterior ribs above the diaphragm, or the right hemidiaphragm is intersected by the 6th anterior rib at mid-clavicular line. For example, this chest radiograph shows adequate inspiration. The 6th anterior rib intersects the right hemidiaphragm at mid-clavicular line, and the 10th posterior rib is above the diaphragm. Thirdly, check the degree of penetration. One should barely see the details of the thoracic vertebrae behind the heart in a well-penetrated radiograph. A poorly penetrated radiograph looks diffusely light and the soft tissue structures are readily obscured, especially those behind the heart. An over-penetrated film looks diffusely dark and features such as lung markings are poorly seen. This chest radiograph, for example, is underpenetrated. The soft tissue structures, including those at retrocardiac region, are not readily seen. This chest radiograph, on the other hand, is over-penetrated. The lung markings are poorly seen. Note that the pedicles and spinous processes of the lower thoracic spine are shown clearly. Lastly, check the inclusion. The chest radiograph should include the entire thoracic cage, including both costophrenic angles and lung apices. Thank you.